Hi, my name is Crystal Unger. I am going to perform the oral exam for the skeletal system for Human Anatomy and Physiology 1. I'll begin with the axial skeleton, which is the skull, the ribcage, and the vertebrae. Frontal bone is separated from the right parietal and left parietal by the coronal suture. Parietal bones are separated from one another by the sagittal suture. Right temporal bone, left temporal bone, separated from the parietal bones by the squamous suture. On the temporal bone, we see the zygomatic arch. Anterior to the temporal bone, we see the sphenoid bone on both sides, but it is just one bone. Posteriorly, we move to the occipital bone, which is separated from the other skull bones by the occipital suture. Moving to the face is the right zygomatic and left zygomatic. We see the temporal arch on the zygomatic. The lower jawbone is called the mandible. The upper part of the jaw is formed by the right maxilla and the left maxilla. The orbit is comprised of the frontal bone, zygomatic, maxilla bones, as well as the sphenoid bone posteriorly. Anteriorly to the sphenoid bone into the midline is the ethmoid bone, which can be seen in the right socket and the left socket, but it is just one bone. Anterior to the ethmoid bone is the right lacrimal bone and the left lacrimal bone in the left socket. Looking at the nose, we have the right nasal bone and the left nasal bone. Looking in the nasal cavity, in the midline is the former. To the left of the former is the left inferior nasal concha. To the right is the right inferior nasal concha. Actually, you can see the ethmoid bone in the very back of there as well. Underneath the mandible is the hyoid bone. It is not present in this model as it is not attached to any other bones. Moving to the vertebrae are broken up into several sections, beginning with the cervical vertebrae. C1 of the cervical vertebrae is called the atlas. C2 is the axis. We then move to C3, C4, C5, C6, C7. Moving on to the thoracic vertebrae is T1, T2, T3, T4, T5, T6, T7, T8, T9, T10, T11, T12. Moving on to the lumbar, we have L1, L2, L3, L4, and L5, and then we have the sacrum, followed by the tailbone or the coccyx. Moving to the rib cage. Typically in a human, there are 12 ribs on each side. Ribs 1, rib 2, rib 3, rib 4, rib 5, rib 6, rib 7 on the right side, and rib 1, rib 2, rib 3, rib 4, rib 5, rib 6, and rib 7 on the left side are all called true ribs as they are directly attached to the sternum. Rib 8, rib 9, and rib 10 on the right side, and rib 8, rib 9, rib 10 on the left side are false ribs as they are attached to the sternum but not directly. Underneath that, we have rib 11 and rib 12 on the right, and on the left we have rib 11 and rib 12, and those are floating ribs as they are not attached to the sternum at all. Moving to the appendicular skeleton, we have the shoulder girdle, which is comprised of the right clavicle, left scapula, right scapula. The scapula are attached to the right and left humerus by the glenoid process. We then have the right radius and right ulna. We then over here we have the left radius, left ulna. Looking at the left hand, you can see the carpal bones. We have the scaphoid, lunate, triquetral, pisiform. Going to the next row, we have the trapezium, trapezoid, capitate, hamate. Moving distally from the body, we then have the metacarpals. We have metacarpal of the first digit of the left hand, metacarpal of the second digit, metacarpal of the third digit, metacarpal of the fourth digit, metacarpal of the fifth digit, all of the left hand. The thumb then has two phalanges, or phalange. The singular form of phalange is phalanx. We have the proximal phalanx and distal phalanx of the first digit. Moving to the index finger, we then have the proximal, intermediate, distal phalange of the second digit. Moving to the middle finger of the left hand, we have the proximal, intermediate, distal phalange of the third digit. Moving to the ring finger, we have the proximal, intermediate, distal phalange of the fourth digit, and moving to the pinky finger, we have the proximal, intermediate, distal phalange of the fifth digit. The same is repeated on the right side, and for good measure, I'll show you those as well. In the carpal bones, we have the scaphoid, the lunate, the triquetral, and the pisiform. Moving to the second row, we have the trapezium, trapezoid, capitate, and hamate. We then have the metacarpals of the right hand. We have the metacarpal of the first digit, metacarpal of the second digit, metacarpal of the third digit, metacarpal of the fourth digit, metacarpal of the fifth digit. Then again, the thumb only has two phalanges. We have the proximal phalanx of the first digit and the distal phalanx of the first digit. Moving to the index finger, we have the proximal, intermediate, distal phalange of the first digit. Third or middle finger is the proximal, intermediate, distal phalange of the third digit. Moving to the ring finger, we have the proximal, intermediate, distal phalange of the fourth digit, and on the pinky we have the proximal, intermediate, and distal phalange of the fourth digit. Moving to the pelvic girdle, we have the coxal bone, which is comprised of three sections: the ilium, but this is the iliac crest. We have the pubis on the right and left, and we have the ischium, which is right here. The coxal bone is attached to the right femur and the left femur. We then have the right patella and the left patella, right tibia, right fibula, left tibia, left fibula. Looking at the foot, the ankle joint is formed by the tarsal bone called the talus. The heel bone is the calcaneus. Looking back at the foot, you can see this. There's the talus. Underneath the talus is the navicular, and then going further down beyond the navicular right here is the cuboid, the lateral cuneiform, intermediate cuneiform, and the medial cuneiform. Underneath these tarsal bones are the metatarsal bones. You have the metatarsal of the first digit of the right foot, metatarsal of the second digit, metatarsal of the third digit, metatarsal of the fourth digit, metatarsal of the fifth digit, all of the right foot. Below that, you then have the phalange. Like the thumb, the big toe only has two phalange. It has the proximal phalanx of the first digit and the distal phalanx of the first digit. Moving to the second toe, you have the proximal, intermediate, distal phalange of the second digit. Moving to the third toe, you have the proximal, intermediate, distal phalange of the third toe. Moving to the fourth toe, you have the proximal, intermediate, distal phalange of the fourth digit. And then finally the pinky is again repeated. You have the proximal, intermediate, distal phalange of the fifth digit. The same is repeated on the left side, but I will show you also for good measure. We have the ankle joint, we have the talus, the heel is the calcaneus. Underneath the talus right here is the navicular. We then have the cuboid, the lateral cuneiform, intermediate cuneiform, and the medial cuneiform. Under those tarsus bones, we have the metatarsal, under those tarsal bones, we have the metatarsal bones. We have the metatarsal of the first digit, metatarsal of the second digit, metatarsal of the third digit, metatarsal of the fifth digit, metatarsal, of the fourth digit, metatarsal of the fifth digit, all of the left foot. Underneath that, you have the phalanges. The big toe, you have the proximal phalanx of the first digit and the distal phalanx of the first digit. On the second toe, you have the proximal, intermediate, and distal phalange of the second digit. Of the third toe, you have the proximal phalanx, intermediate phalanx, and distal phalanx, all of the third digit. On the fourth toe, you have the proximal phalanx, intermediate phalanx, distal phalanx of the fourth toe. And lastly, on the pinky, you have the proximal phalanx, distal phalanx, or excuse me, intermediate phalanx, distal phalanx of the fifth digit of the left foot. Thank you. Have a good night.